Nail fungus. What is onychomycosis? Nail fungus or onychomycosis is an infection of the nails occurring both on the hands and feet, but certainly more prevalent on the feet due to the environment that feet find themselves in. This condition was rarely seen 100 years ago, but has become more common due to the lifestyle changes we all experience, such as communal bathing areas, greater use of occlusive footwear, and the increasing incidence of diabetes. Athletes, particularly runners, are more inclined to develop this problem. The incidence of onychomycosis increases with age, the majority being over age 55, but we also see it in teenagers as well. For most people, this is a progressive disease that, if left untreated, will continue to spread from toe to toe. The true, tough to get rid of fungus actually grows underneath the nail. As it grows, it forces the nail up off the nail bed, and the nail becomes thick, crumbly, and discolored, ranging in color from yellow to brown. What is wrong with having fungus nails? Cosmetically unappealing. Makes you more susceptible to developing athlete's foot. Increases the chance of developing secondary bacterial infections in your feet. Pain in closed shoes from the thickness of the nails. Increase the chances of developing painful ingrown nails. The sheer distortion of the nails tends to irritate the healthy skin of the adjacent toes, causing abrasions that can become infected. Treatment of onychomycosis. Treatment can be difficult because of the fact that nail fungus thrives in dark, moist environments. Wearing closed shoes and socks all day with feet that perspire creates a perfect breeding ground for nail fungus. Eliminating those factors can go a long way to reducing recurrence. Oral medication for fungus nails. For years, the gold standard for treating onychomycosis in an otherwise healthy individual has been oral therapy. Your doctor may prescribe 1 or 2 blood tests during the course of therapy to make sure there are no adverse effects. Additionally, your doctor should take a sampling of the nail and have it tested to confirm that it is true nail fungus. Visual inspection is not the proper way to make a diagnosis. Many times a thickened nail is nothing more than keratinization of the underlying nail bed, which is a thickening of the skin underneath, usually from repeated trauma. Topical medication for fungus nails. Although topical treatments are available, they tend to be less effective. The main problem, as stated earlier, is that fungus grows underneath the nail, so applying medication to the top of the nail becomes an effort in futility. Trying to force the medication underneath the nail rarely works. The best way to use topical medication is to see a foot specialist who will grind down and cut away as much of the diseased nail as possible, a painless procedure, so that the topical medication will penetrate to the live fungus more readily. Keep in mind there can be failure using either topical or oral medication. But, here is an important point to take away from this article, and that is, if you only have a little fungus, such as maybe on a nail or 2, you are much better off trying to eradicate that rather than waiting, while the condition further worsens, and then you are stuck trying to clear up a more severe case. Laser surgery for fungus nails. The last option available for nail fungus is laser treatment. Studies are now available that are older than 1 year, and I have seen some very impressive results. I have personally found that people prefer laser surgery over other options because it is a safe, painless procedure with the highest rate of success. Preventing the recurrence of nail fungus. No matter what treatment method you employ to rid yourself of those unsightly nails, that ends up only being half the battle. The other half is preventing recurrence. There are many reasons people develop fungus. It may be from nail trauma in playing sports to those people who develop it simply because of the environment their feet live in. Once your nails have cleared up, here are my recommendations for prevention. Better hygiene of the feet. Use of an antifungal soap such as tea tree oil soap. Regular bar soap does not have antifungal properties. Use of an oil-based topical antifungal nail medication to create a protective coating over the nails. Use of a topical antiperspirant for feet such as Onox spray. Avoiding the use of nylons which promote perspiration. Allowing shoes that are moist inside to dry out before wearing again. Spraying them with an antifungal such as tiniacide spray will help destroy any fungus residing inside your shoes. Keeping the nails cut short. Space between the nail and the skin underneath is a focal point for new fungus infections. Lastly, women who wear toenail polish on a very regular basis are more prone to nail fungus, generally the superficial type of nail fungus. This is because the polish, when applied, traps moisture on the nail and thus fungus may begin to grow. When the polish is removed, the nail appears yellowish with pockets of white specks. If left alone, this will usually invade the nail plate and become the deep type of onychomycosis. The good news is that this superficial type of fungus can be sanded out with an emery board, and along with application of a topical antifungal and the avoidance of regular polish, the nail will remain healthy. Read the complete article at www.fot-pain-explained.com/nail-fungus.html